This is CGTN, China Global Television Network.
The UN-backed government in Libya imposes 24-hour curfew for 10 days as the country confirms 13 new cases of coronavirus. Amid lockdowns in Africa, some schools keep the doors of learning open through online classes. And in case you've been wondering what the animals have been getting up to during lockdowns, we take you to South Africa's Kruger National Park. Hello and welcome. You're watching Africa Live. We're coming to you live from Nairobi. I'm Hannah Viviers and I'll be with you for the next hour. But joining me for the latest in business is Rama.
Thank you very much, Hannah. Here's what's coming up in business news. Finance officials from the G20 have agreed to suspend debt service payments for the world's poorest countries. And the Agricultural Bank of Egypt has unveiled plans to help farmers cope with the COVID-19 pandemic. We'll speak to the institution's chairman in the course of the hour. For now, let's start with the latest in current affairs with Hannah.
Thank you so much, Rama. Let's start with the latest numbers on the coronavirus pandemic. More than 2 million people around the world have been infected with COVID-19. 138,000 people have died. Over the past 24 hours, the United States has seen 29,000 new cases and 4,000 more deaths. The U.S. now has about a third of the world's cases. More than half of all cases are in Europe, with Spain and Italy the hardest hit. There are 180,000 infections in Spain, followed by Italy with 165,000. All of Japan is now under a state of emergency as COVID-19 cases rise. It expands an earlier order that covered Tokyo and 6 other regions.
The 6 prefectures of Hokkaido, Ibaraki, Ishikawa, Gifu, Aichi and Kyoto have seen widespread infections at the same rate as that in the 7 prefectures currently under a state of emergency. An upward trend is also evident in other prefectures as a result of infection clusters from the urban migration. Therefore, state of emergency measures will apply to all prefectures to suppress regional outbreaks and minimize movement of people, especially during the Golden Week.
Japan's annual Golden Week holiday is in early May when many people travel. The emergency declaration will now last until May the 6th, at least. Shinzo Abe is facing criticism for reacting too slowly to the virus, and several local leaders have launched their own measures to fight the virus. The World Health Organization warns Europe is not out of the woods yet, this even as some of the world's worst hit nations see signs of recovery.
In the past 10 days, the number of cases reported in Europe have nearly doubled to close to 1 million. This means that about 50% of the global burden of COVID-19 is in this region. Sadly, over 84,000 people in Europe have lost their lives to the virus. Make no mistake, despite the spring weather, we remain in the midst of a storm.
Still, the WHO Regional Director for Europe says there are hopeful signs on the continent, even though the situation worsens in countries like the United Kingdom. He also hailed Europe's support for the Global Health Agency after U.S. President Donald Trump announced a halt to funding.
We have been receiving, indeed, in fact, we have been overwhelmed by the support of European countries, but also people of Europe and all over the world to the mission of WHO. We are looking at the finance situations. Some commitments have come in, but for the time we are in the midst of the crisis. So what we focus on is to save lives.
Let's now take a look at how the coronavirus has been spreading in Africa. There are now nearly 18,000 confirmed cases of COVID-19 across the continent. According to the Africa Centers for Disease Control, there have been more than 900 deaths and more than 3,500 recoveries. Egypt, Morocco, Algeria, and South Africa have the highest number of infections. Each have more than 2,000 cases. Meanwhile, in Malawi, nurses have gone on strike after the government failed to hire more health workers in their fight against COVID-19. While Botswana has pardoned 149 prisoners to help decongest prisons and prevent the spread of COVID-19. Well, the UN-backed government in Libya has imposed a 24-hour curfew for 10 days to prevent the spread of COVID-19. The curfew will start on Friday. That's according to reports quoting a statement from the government based in the capital, Tripoli. Libya has 48 confirmed cases of COVID-19 and has reported 1 death. All vegetable and meat markets will be closed during the curfew. Meanwhile, in Nigeria, a doctor has died from COVID-19 while managing an infected patient at his private clinic. The deceased, Dr. Chugbo Emeka, was admitted to Lagos University Teaching Hospital on Monday. He passed away on Wednesday. In neighboring Ghana, the country has extended an initial 2-week lockdown as a number of infections continues to rise. Aerial views from one of Accra's drone pilots revealed deserted streets and empty markets.
A drive-through Kwame Nkrumah Circle. This is where all major transport businesses are located. It is the second busiest place in the city, but now it's empty. Ghana is one of the few countries in West Africa that have imposed a total lockdown in the fight against the spread of the novel coronavirus. The capital's normally busy streets are deserted, with only police checking papers of the essential staff who are exempt from the lockdown. The virus was slow to reach African countries, but cases are rising fast. As at April 16th, CDC figures show that Africa has over 17,000 cases and more than 900 have died from COVID-19. Ghana has confirmed 641 cases, having tested more than 27,000 people. During the last 2 weeks of the lockdown, the government has introduced several measures including enhanced surveillance, contact tracing, social distancing and public awareness campaigns. The government also started producing more than 3 million masks and personal protective equipment after calling on 5 garment companies whose workforce has come out of lockdown to mass produce the suits. Beryl Oro, CGTN.
Zanzibar has announced 6 new cases of COVID-19, bringing the total number of confirmed cases there to 24. The announcement now pushes Tanzania's number of patients who have tested positive to 94. Unlike many other countries around the world, Tanzania has not implemented strict crowd control measures. Earlier, we spoke to CGTN's Daniel Kijo.
Tanzania has indeed have relatively low cases of the virus as compared to its neighbors. Now, the last couple of weeks, we've seen increases since the first reported case. Now, the reason that Tanzania could have these low numbers and sudden jumps is the fact that most of the initial reports were from imported cases, meaning that once the cases were reported, the government was working hard to track and contain these cases. However, a couple of days ago, the health minister, Umi Mwalimu, announced that now Tanzania has entered the community level of infections, meaning that it's no longer just imported cases. Now it's being transmitted between citizens who have had no international travel history. Experts advise that this could be the reason why there's now this sudden case, because now it's no longer just travelers, but citizens themselves are spreading the virus. We know that Dar es Salaam, which is a commercial hub, has the highest number of cases, which can be also due to the highest population density that has led to a higher transmission rate. So basically, now it's community to communities, and I think that is why the numbers are increasing drastically. The government has been insisting that people should wash their hands, should sanitize, and should avoid large crowds. To emphasize this, the government banned school, has closed school for 30 days and extended it yesterday. It has also banned sports. It has also made sure that people who have weddings and anything that involves large gatherings to cancel it. However, regarding lockdowns, the president in his address a couple of days ago during Easter said that Tanzania will not issue a lockdown, and that too many countries, landlocked countries who are neighbors to Tanzania, about 8 countries depend on Tanzania's port, and also some goods from Tanzania's different markets here, like Kariakoo. So if indeed Tanzania closes its borders and does lock down, this could affect millions of people in the region, not just Tanzania. As it stands, Tanzania's government has said there is no lockdown in the near future, but with the numbers rising now, there could be changes in the coming days, but the government is sure going to communicate that to its people.
Somalia has reported 80 cases of COVID-19. The country says 5 people have succumbed to the disease. Here's CGTN's Abdulaziz Bello, who is in Mogadishu, on some of the measures that Somalia is taking to limit transmission.
Somalia's police chief is inspecting troops manning key roads and intersections in Mogadishu before a night curfew takes effect amid increasing COVID-19 infections. Extra security personnel have been deployed to popular hangout spots, including restaurants and indoor sporting facilities that are filled most nights.
The objective of the curfew is to limit the spread of the coronavirus. I thank the people of Mogadishu and police for adhering and enforcing the curfew. We have mobilized personnel from local district administration to ensure the curfew is not violated.
Health officials have attributed the rising cases to community transmission. Local authorities and private companies have since placed water tanks and soap in public places to encourage hygiene as the first line of defense in fighting the coronavirus. However, the curfew will not affect medical personnel, media, and other essential service providers.
People are cooperating with us. They have remained at home to prevent further spread of the virus. We have also created an emergency service center. Ambulances are on standby for emergencies during the curfew period, and we have advised police to assist needy cases.
Restriction in movement is expected to have a huge impact on restaurants and entertainment spots like this one.
This is one of many busy intersections in Mogadishu from which locals come here to get public transport vehicles to their respective destinations. In less than an hour, this street will be empty, with strict measures taken against those who fail to comply with government's directive. Abdulaziz Bello, CGTN, Mogadishu, Somalia.
The Africa Centers for Disease Control and Prevention is encouraging countries to enhance their existing coronavirus surveillance to include pneumonia cases. Some countries are already moving towards mass testing of their citizens. CGTN's Coletta Wanjohi reports from Addis Ababa.
Countries in Africa are increasing their testing capacity for coronavirus. South Africa has done over 90,000 tests, Nigeria and Ghana over 50,000, and Egypt over 25,000. Now Kenya has announced it will begin testing at least 1,000 people per day. Countries opting for mass testing are concerned by positive cases being confirmed from people who do not even have any travel history and the growing cases of asymptomatic people. The Africa CDC says the decision depends on the level of outbreak in a country.
Different countries are at different levels. If you still have 1 or 2 cases, you can be able to avoid mass testing. If you have started reaching many hundreds, you are passing into thousands, then for sure the need for doing testing aggressively is very important. And this is just one tool in the public health space. Many governments have done lockdowns. And when you do lockdowns, that is the opportunity to do mass testing so that you can be able to identify all those who are carrying the virus and isolate them so that they don't continue to transmit to others within the community.
But some countries that have done lockdowns are not going for mass testing, majorly because of the high cost of test kits.
As Africa CDC, we have gone into a coalition with other partners, manufacturers and distributors. We are trying to make sure that we do not run out of tests, and we are also trying to make sure that as new companies bring new tests into the market, we are discussing with them so that Africa has a portion of whatever is being produced globally.
The Africa CDC warns that testing people without symptoms wastes resources. It may also provide false reassurances that the person has no risk of COVID-19. And if the patient is in the incubation phase, the test could be negative. Coletta Wanjohi, CGTN, Addis Ababa, Ethiopia.
Time for us to take a short break and return. Critical medical supplies from the UN arrive in Nigeria to bolster efforts in curbing COVID-19. And amid lockdowns in Africa, some schools keep the doors of learning open through online classes.
You don't find the stories of North Africa by sitting on the sidelines. You've got to get out, go there, and you'll find them. In the bazaars of Casablanca, among the crowds in Cairo,
who come to visit Cairo, the ancient capital of Egypt.
Along the waters of the Nile, along the sands of the Sahara. No one else will take you where we can in North Africa. No one else will show you what it's all about. CGTN, see the difference.
Welcome back. Well, through the UN's COVID-19 basket fund, medical supplies have arrived in Nigeria. With more than 400 coronavirus cases and a healthcare sector experiencing equipment shortages, this donation aims to bolster government efforts in curbing the outbreak. CGTN's Kelechi Emekalama reports.
A cargo plane loaded with medical supplies arrived the Abuja International Airport. The items consist of 50 ventilators and personal protective equipment, all bought by the UN through its recently launched COVID-19 basket fund. It's an intervention aimed at boosting government's effort to provide effective healthcare response.
This is a trying moment for all of us. We are witnessing today our humanity under threat by COVID-19. The only information we know is that we should be able to identify, test, isolate and treat the affected population. Nigeria has always demonstrated that they can live to this expectation. The work that was done by Nigeria during the Ebola crisis was a commendable one. So we are looking forward to the authorities to do a similar job in trying to contain this COVID-19 pandemic in Nigeria.
Nigerian authorities are pleased with the intervention described as timely. Nigeria has hundreds of confirmed cases and a fatality rate of about 3%. Authorities have been battling to curb the spread of the virus as well as provide the needed health care to those infected.
It is humanity that binds us together, and it is that humanity that you have demonstrated today. We thank you very much for this gesture, and we will do everything possible to use this to assist our people, particularly those that are positive for this COVID-19.
Other support agencies that we're grateful to as well, including the airline, Allied Air Cargo, who volunteered to ship this consignment from Lagos into Abuja at a very, very short notice.
The medical supplies would be distributed to states across the nation, particularly those worst hit by the virus. With a population of around 200 million people, authorities project the cases could rise in the coming weeks. The next shipment of personal protective equipment is expected to arrive Nigeria by month end. Kelechi Amekalam, CGTN Abuja, Nigeria.
Meanwhile, schools in Uganda have found innovative ways to keep students studying even while at home. Amid a coronavirus lockdown, class content is being broadcast on social media platforms. Leon Seanga reports.
For an hour a day, Daniel Muwereza goes through a new routine. Using video and social media, he teaches his students from an empty classroom. As remote as it may be, it is the new way of keeping his classes on.
This is an idea that we came up with after the outbreak of this pandemic, and we wanted to continue helping our learners. So we came up with this idea, and we were able to sensitize some of them, get online, and we continue sharing with them.
And it has come in handy for Mark Mugera, a primary 5 student of the Bright Primary School. Under the watchful eye of his mother, he can study.
It is helping me a lot because when I'm at home, I don't get time. Sometimes I don't get time to read the books. So now this time I've got a lot of time. I've learned even some new things.
Again for the student, but an expensive plan for parents. Internet costs are piling up on daily expenses.
You can't watch this for long because data runs out. We have to keep buying data and also pay internet tax. That is difficult for me.
The COVID-19 crisis has taken away 2 months from the first term of this year's schooling calendar. Teachers are now focusing students on certain work to make sure they'll be ready for their final year exams.
We try to get the areas which we think that are challenge to these children, and those are the areas that we emphasize much on.
It is still uncertain when schools will reopen, but as and when they do, there will be a lot of catching up on classwork for both teachers and students. Leon Sanyange, CGTN, Kampala, Uganda.
In Burkina Faso, a local television station called Burkina Info has initiated televised courses for students amid the COVID-19 pandemic. This follows the closure of all schools and universities in the country. Different subjects are being broadcast. The televised courses are in collaboration with teachers. CGTN's Tunisha Balala reports.
Burkina Faso is using television to keep students updated with the school curriculum. The TV channel is called Burkina Info. Students are taught basic subjects such as maths, physics, chemistry, philosophy and French. The ongoing coronavirus pandemic has forced government to shut down all learning institutions.
As a student in the final year of high school, it doesn't suit us to stop classes because the exams were already closed. We were 2 to 3 months away from the exams, so we were preparing. Frankly, I think it's a program that helps us a lot. It's not always easy to work at home because the setting is not appropriate. But now with these courses that we take on TV, even if the understanding is not like in class, I can say that it helps us a lot and it allows us to catch up a little bit.
I try to stay at home. I don't go out anymore, and I take advantage of this free time to work, study, and also follow classes on TV. I think it's a very interesting show because it helps us a lot. Before the resumption, we try to get up to date while waiting for this disease to disappear.
The classes are taught by qualified teachers. They broadcast at least 4 to 5 times a day, and classes last just for 1 hour.
In addition to giving the lessons on TV, we try to advise the students. We always recommend that students take the exercises we develop during the show. I think that giving the lessons on TV is not enough. You need a willingness on the part of the student to be able to retain something.
The Tele-Education Initiative is a first for Burkina Faso. The initiators are delighted to provide a solution to the country's education during a global pandemic.
The media, which has a role of information but also of citizen contribution to the education of the masses, has played their part in initiating such a program which naturally aims at encouraging pupils in examination classes to learn despite the closure of classes. And we think that today most fathers, students and everyone finds something to gain from what we do. In Burkina Faso, there are more than 5 million pupils in the whole country, so that's a lot of people. And it is a rather important target that should not be neglected in the context of the fight against COVID-19.
Schools in Burkina Faso were closed on 16 March. And the resumption of activities has been postponed until the end of April. Thuli Shabalala, CGTN.
Well, it's time now for us to take a look at what we can expect in the world of business. Here's Rama.
Thank you very much, Hannah. Here's what's coming up in business news. Finance officials from the G20 agreed to suspend debt service payments for the world's poorest nations. And the Agricultural Bank of Egypt unveiled plans to help farmers cope with the COVID-19 pandemic. We'll be speaking to the chairman shortly.
Africa is the nexus of enterprise, and global business will tell you why it matters.
From the mega investment projects to multi-billion-dollar mergers and acquisitions.
Africa today collects, just in terms of revenues from taxes alone, $545 billion a year. If you take 10% of that and you devote it to the energy sector, problem solved.
All this on Global Business, weekdays at this time on CGTN.
Let's start in the world of debt. G20 officials have agreed to suspend debt service payments for the world's poorest countries through to the end of 2020. Now, the Wednesday move was quickly matched by a group of hundreds of private creditors. The announcement comes in the wake of a video conference meeting of finance ministers and central bank governors hosted by Saudi Arabia, which currently holds the rotating presidency of the G20 this year. The kingdom's finance minister, Mohammed Al-Jadaan, said that the move to freeze both principal and interest payments will free up more than $20 billion for countries to then spend on improving public health systems and fighting this pandemic. The debt standstill offer is open to the world's poorest and least developed nations.
Our actions today include a G20 initiative to suspend debt service payment for the poorest countries. All bilateral official creditors will participate in this initiative. And through this platform, I also call on private creditors working through the Institute of International Finance to participate in this initiative on a comparable terms. We are not happy with oil prices, so is other oil producers, but we need to make sure that the energy market is balanced, as we have been doing for decades in Saudi Arabia. As I said earlier, the G20 members have accepted the invitation of the G20 presidency and held energy ministers meeting, extraordinary meeting last week, in which they have actually supported the agreement that was reached by the OPEC and OPEC Plus and called for action to ensure that market stability is maintained.
The IMF's managing director, Kristalina Georgieva, said that the fund is deploying all of its existing resources and, in fact, it's looking to triple its concessional financing for the world's poorest economies. In a statement made at a meeting of G20 representatives, she said the fund is urgently seeking some $18 billion in new resources in order to fund the fund's poverty reduction and growth trust.
Make sure that we can do more for those that need us the most. And that means aiming to triple concessional financing, which is so necessary for our poor members. What we have seen is central banks providing ample liquidity, $8 trillion of fiscal measures. So our message is spend as much as you can, but keep the receipts. We don't want accountability and transparency to take a backseat in this crisis. We are telling everybody, do all you can. And I just want to assure you that we are following ourselves on our own advice. Everything is on the table in terms of measures we can take.
And this is the sort of support that she's talking about. Ghana is set to receive a $1 billion loan from the IMF in order to deal with economic shocks caused by this COVID-19 pandemic. The World Bank had previously forecast that the West African oil, gas, gold and cocoa producer would be Africa's third fastest growing economy this year. But that was in a different time. This global health crisis is already taking a bitter toll on the country's economy. Here's CGTN's Nabil Ahmed Rufai with this report from Accra.
Ghana's economy is projected to slow down due to the coronavirus pandemic. Businesses have suspended operations and economic activity has almost ground to a halt, with parts of the country in lockdown. The International Monetary Fund has also slashed the country's GDP growth rate for this year from 7.5% to 1.5% due to the impact of COVID-19. Labor unions want the government to protect jobs that could be lost due to the pandemic.
The employers who have kept recruiting, who have managed the unemployment debt stock in this country to the barest minimum that they can, they must quickly be supported. Then they will be able to stand on their feet when this COVID-19 is over, and they will be in a position to have the capacity to engage all employees that they were engaging before, or even have the joy to engage more.
The government has secured a $1 billion loan from the International Monetary Fund to help the country fight COVID-19 and reduce its impact on the economy. The government says the fund will be used to address urgent financing needs in the health sector as well as some social interventions.
Government should first of all draw a program as to how these monies are going to be dispensed. They must make it as public as possible, that everybody can appreciate what is actually happening.
Ghana secured a nearly $1 billion IMF bailout in 2015 to restore its economy, exiting the program in 2019. Ghana's budget deficit is projected at 4.7% of GDP this year, but economists expect the deficit to widen because of lower revenues due to the coronavirus pandemic. With the government securing the IMF loan, the country's debt stock is also expected to rise. Nabil Ahmed Rufai, CGTN, Accra, Ghana.
In South Africa, residents of Manenberg, it's a suburb of Cape Town, broke into shops and started looting food supplies. Mobile phone footage recorded on Tuesday shows a group of people running into and out of a supermarket, carrying baskets and tossing food into trolleys before then sprinting away from the scene. In Joburg's crowded township of Alexandria, residents gathered outside a school waiting for food parcels that never arrived, and that resulted in a fair bit of chaos. Police officers later dispersed the crowd. The country is in its third consecutive week of lockdown, which aims to stop the spread of COVID-19. The country has the most confirmed coronavirus cases in sub-Saharan Africa, just over 2,500. That number is still expected to rise, though, as more tests are being conducted in far-flung rural areas and overcrowded informal settlements. 34 people have died so far of COVID-19 in South Africa. Turning to Egypt's banking sector now, specifically the country's agricultural bank. The wholly state-owned institution has been undertaking some reforms recently as the North African state is looking to ramp up domestic food production. CGTN's Adel El-Marouki spoke to the chairman of the bank, Alaa Farouk, about its ongoing restructuring and how the bank can help mitigate the economic damage being caused by this pandemic.
We've postponed all installments due from farmers for 6 months. We've waived the commissions and fees from all ATMs and point-of-sale stations. We join all initiatives led by the Central Bank of Egypt. All of this has been implemented within 30 days of the crisis. We've increased our loan categories and increased all of the limit previously provided. Now farmers can take out loans that are 30 to 50% bigger. These measures have supported many during this critical time.
The Agriculture Bank has been going through a massive restructuring system to make it one of the leading banks in Egypt. How did the bank proceed for this restructuring plan?
We want the Agriculture Bank of Egypt to become one of the biggest banks in Egypt within the next 5 years. The goal is supported by the Central Bank of Egypt, which is providing assistance. Our bank affects farmers, poultry producers, and other animal rearers in the country. We had to develop many critical aspects, full IT infrastructure enhancement, and within 12 to 18 months, we'll have a new data center. We'll be training all our employees. The banking institute should have started with the first 8,000, but unfortunately this has been postponed as public gathering is now banned. We're moving to become the country's hub for financial inclusion. We are working to double our branches so that we can be present everywhere in Egypt.
What is the budget allocated for this huge restructuring plan?
The budget is reviewed by the Central Bank of Egypt and it is giving us its full support. Whatever the cost is, the CBE is paying for it. There are continuous meetings to review milestones. CBE consultants will be supporting the Agriculture Bank through the next 2 years to finalize this plan.
The bank in general provides different services than most public banks. So what are the prime services?
We deal with 75% of industries as well as the agricultural sector in Egypt, so we care about enhancing our performance for them. We are reviewing the current financial products we offer, and will be introducing others to meet the needs of citizens, starting with agriculture and its related industries, like animal production, and what follows those with complementing industries. We will be focusing on SMEs and mid-sized corporations to build full coverage for the entire supply chain. Our clients tend to prefer savings accounts. They like to have access to their cash. Most of them are not interested in long-term investments.
Now, some grim unemployment data came through today from the United States. Over 5 million Americans filed for unemployment benefits this week. That brings the total number of jobs lost as a result of this pandemic so far to 22 million. It effectively wipes out all job gains made since 2009. Filing for unemployment claims, however, has been pretty difficult as the country's online systems are being overloaded. CGTN's Karina Huber found this report from New York.
Laura Mitchell would prefer to be doing someone else's makeup, but she can't. She's a freelance makeup artist who has worked in New York pretty much nonstop for 13 years. Her gigs have included New York Fashion Week as well as CNN. She's also done countless promotional shoots and weddings, but all of her gigs suddenly disappeared. Her last job was on March 11th.
There are no photo shoots happening. I feel like makeup and hair were the first people to get kind of booted out, you know.
They may have been among the first to go, but they were far from the last.
Almost 17 million Americans have filed for unemployment benefits just in the past 3 weeks. This after non-essential businesses across the United States have been told to shut down to contain the spread of the novel coronavirus.
In March, the U.S. Congress passed the CARES Act, a $2 trillion stimulus bill that includes beefed up unemployment benefits. Filers get an additional $600 per week for up to 4 months. Freelancers like Mitchell qualify for benefits for the first time, but filing a claim on the phone has been an ordeal. Mitchell got a busy signal for about a week before finally getting through.
When you were lucky enough to get through all the prompts, enter your social, enter your PIN, it would hang up on you again.
New York's governor admitted there was a problem.
The Department of Labor website basically crashed when it was overwhelmed by the number of callers for unemployment. Unbelievably, we had 1,000 people working on the website, handling the calls. 1,000 people could not handle the input, which is just phenomenal. But we changed the system, we changed the website.
Mitchell was finally able to file a claim and is expecting to start receiving checks soon. It's the first time she's asked for government help.
It could be a lot worse. So as hard as that mental fortitude is, you really have to try to stay grateful and humble and appreciative of where you are.
Karina Huber, CGTN, New York.
One last story for you. This pandemic has disrupted global logistics networks. It's left tons of goods, hundreds, thousands of tons, confined at a source point and unable to reach their destinations. The China-Europe rail line, which started operations in 2011, has remained a reliable transportation channel. It's brought in key supplies and commodities to and from continental Europe, as CGTN's Mang Ching-Cheng now reports.
Inside the international railway port in the southwestern Chinese city of Chengdu, workers are busily loading cargo onto containers. Aboard the China-Europe Railway Express, these commodities will arrive in the German city of Duisburg in 2 weeks' time. Yusen Logistics, known for its ocean and air freight forwarding, has prompted a strategic move following the COVID-19 outbreak.
We have shifted our traditional air and shipping deliveries to the China-Europe trains here in Chengdu, and we have also diverted our goods from eastern and southern China to the city. They will enter the markets in Europe and the Far East.
Train service in Chengdu recorded over 400 trips in the first quarter, an increase of 84% year-on-year. As a result of the pandemic, cross-border e-commerce rose 21 times.
By the end of March, we had achieved a breakthrough of over 1 million orders in cross-border e-commerce. Its shipment value reached over $15 million. The railway plays a key role in promoting trade and industrial development.
During the same period, freight trains across China made over 1,900 trips to Europe, carrying 174,000 TEUs of containers, an increase of 15% and 18% year-on-year, respectively.
Despite the COVID-19 outbreak across Europe, railway authorities here in China have taken multiple measures to ensure smooth global logistics channels, and they have prioritized the shipments of epidemic prevention materials.
By the end of March, China-Europe trains delivered nearly 500 tons of aid material to countries like Italy, Germany, and Spain. And the measures include ensuring a safe and continuous flow of traffic and piloting paperless information exchange with customs. For companies like Yusen, railway transportation will remain the pillarway for intercontinental delivery, at least in the foreseeable future. Meng Xingsheng, CGTN, Sichuan Province.
I'll leave you there for the time being, but I'll be back at the top of the hour. We'll be looking at the very grim choice faced by African governments as the COVID-19 pandemic continues to ravage economies and healthcare systems across the continent. Can they continue to impose these lockdowns, or should they focus on fixing the economic problems that the lockdowns are creating? We'll explore that in detail at 1800 GMT. See you then. For now, back to Hannah.
Very complicated issue, but we'll be taking a little bit more look at that, Rama, after the break. Well, thank you so much. We're going to be taking a short break. When we return, more news, including Pilots Initiative in South Africa delivers food to vulnerable communities.
Join us in Global Business and see Africa through our eyes. The greatest journeys, the greatest sights, the greatest adventures.
Here in Kanata, this weir allows the locals to walk on water.
We're far more than just TV news. We're your passport to the wonders of Africa.
To bring you stories of struggle, survival and hope.
So let's explore. CGTN. See the difference.
Welcome back. In South Africa, a group of pilots have come together to form COVID Flight, an initiative that delivers food parcels to remote communities. The country has so far reported over 2,500 cases of the coronavirus. Over 30 people have died. A nationwide lockdown to curb the spread of the disease has left many reliant on donations.
In a display of solidarity during South Africa's lockdown, a group of pilots have come together to form COVID Flights. They have been distributing food, medical supplies and personnel to remote areas around the country. The nationwide lockdown has had a severe impact on various vulnerable groups.
I got a message from Lebo and they said generally they got decent food distribution and their channels of food are reasonably good. On Monday he phoned and said they've got no food, their kids haven't eaten for 4 days and they have to turn the people away, and they said they really need help with the whole process.
Winterveld is one of the countless communities under strain. The project was set in motion after members of this community reported having gone 4 days without food.
This food is helping me since I've got 10 family members to support. I am the head of the household, so these food parcels will definitely help me since the child support grant is not enough. I have older children and the grant only supports my grandchildren.
A centre for orphans and vulnerable children in the area is now serving as the distribution point for the COVID flights. Klongwane is one of the beneficiaries.
I'm excited about the food because we sometimes go to sleep without eating. I'm used to getting food during school days when we get cooked meals from the center.
Several farmers have already donated to the cause.
The farmers literally gave their best stock. It wasn't They used the tarnished fruit that they couldn't supply into the market and so on. So they literally gave their best stock to us. And it was something very special to see this community looking after that community.
The pilots say they execute each mission in accordance with government protocols. The team has so far delivered over 7 tons of food in their first 3 days of flying. Daniela Pearson, CGTN.
As people in various countries remain in lockdown during COVID-19, this is what animals have been getting up to since the lockdown in South Africa. With no tourists and motor vehicles parked up close to disturb them, this lion pride in the Kruger National Park enjoys some peace of mind. And the elephants enjoy a tussle in the afternoon sun. Your sports news is coming up after the break. Here's a highlight. Spokespersons living with a disability in South Africa feel the effect of coronavirus pandemic lockdown.
How would you create your legend? On the fields, on the tracks, in the arenas of Africa. Were you born to be a player? Could this moment be yours? Sports Scene. Find your game.
Africa Live. Find your voice.
Time now for your sport news. The COVID-19 pandemic has affected all areas of life. Sport is no exception. The spread of the coronavirus has had a severe impact on the sporting calendar of persons living with a disability in South Africa, with many national and international tournaments cancelled. CGTN's Julie Shaya reports.
The impact of COVID-19 on the sports industry is tremendous. It's affected every sporting code around the world. In South Africa, disabled golf and wheelchair tennis have also been impacted.
As South Africans, we are definitely affected by this coronavirus because you can imagine our programs have been stopped. We no longer have coaching at centers, and you can imagine, I mean, some of the centers, the only thing they can do is wheelchair tennis, because remember, wheelchair tennis is the only sport in South Africa that can reach to rural areas.
At international level, South Africa's participation in the Wheelchair Tennis World Team Cup in Portugal has also suffered as a result.
It didn't only affect the development level, but it also affected the high performance level, where we have players that just qualified for World Team Cup. We're supposed to be in Portugal in May to participate in World Team Cup. And now that, you know, because of coronavirus, everybody needs to be safe. High Performance Center, which is where they are training and preparing for themselves, it had to, you know, make sure that everybody's safe, and they stop, and then they had to go home. So everybody's affected. We can't play World Team Cup anymore.
SA's Disabled Golf Open, a premier tournament on the continent, has been postponed and all development golf activities put on hold.
We've got two main streams. The one is tournaments. The more critical one is the first swing program. That's affecting the whole country, actually, because we've got all over South Africa, we've got schools that we provide adaptive golf development, and all these have halted. Then on the second leg, our SA Canon Open have also been suspended. We're not sure till when. Hopefully we'll still be able to have it this year. So it's impacted disabled golf as it's impacted all the other sports internationally severely.
Postponements, cancellations are just the first of what are no doubt many significant decisions to come in the world of sport. But at the moment, public health is more important, even if it's costing South African sports millions of rands. Judy Shara, CGTN, Johannesburg, South Africa.
We cross over to West Africa now. It's a tough time for football fans in Nigeria, where the game is the most popular over every other sport. With all activities across the world suspended as a result of the COVID-19 pandemic, both football players and fans in Nigeria say they miss the game a lot. TGTN's Deji Badmos has more.
Nothing better reflects the impact of COVID-19 on sports in this country than this locked stadium. It's a national stadium in Lagos and has been under lock for the past 3 weeks now, and there's no sign that it's going to be reopened in the coming days or weeks. There's nothing anyone can do about it, even though sports lovers do not like it. Safety actually comes first, at least before sports. The stadium was shut just days after Nigeria recorded its first case of the coronavirus pandemic. And shortly after that, other stadiums in the country were shut as well, and a blanket suspension was placed on all sports. In a country where football is the predominant sport and many look forward to weekends of football games, especially from the foreign leagues, fans of the game are in disbelief that they've been able to go on for weeks now without any game, even in the local league.
I miss football a lot, like really a lot, most especially this lockdown period. I would have personally been watching football every weekend and all of that, but now there's nothing to watch. Somebody just go home, is bored, nothing at all.
Over the weekends, you have early kickoffs from like 12:30 to around 8:30 in the night. You still find yourself very much glued to the TV set watching this game. So for me, it's not just a game. It's something personal now.
Trying to stay in shape. Abu Aziz and Omoyele Tosin both play football for two club sides in the Nigeria Premier League. They've been home now for the past 2 weeks since the domestic league was suspended because of the outbreak of the COVID-19 pandemic in Nigeria. They say they can't wait to get back.
We think it's a joke. It's something that we'll just like go home for 1 week, then we'll go back to our various team. But since we realize the team is getting worse, something like that, as a footballer, we have passion, it's our job. It's something that we have been doing for a living.
While they keep in shape and weight, there's no certainty for now when the league would resume so they could go back to their clubs. But fans and players are not the only ones affected by the suspension of football globally. At this time of the weekend, this viewing center would have been jammed with football fans watching football matches. But unfortunately, since football was suspended virtually across the world as a result of COVID-19, viewing centers like this across Nigeria have taken a big hit. It's bad business for those who are operating them.
The business has really been bad, yeah?
And Edwin Onogewe is one of them. He says his viewing center has not been operational since the suspension of football and the lockdown in the country, and he's had nothing else to do.
There's no league, so there's nothing I could do. I'm just surviving, somehow. I know I'm surviving.
For those who put their money where their heart is, let's say betting, there's no game to bet on, so money is not coming in. For those who own those very small shops also, like agents to these betting guys, the shops are locked up.
It's indeed a tough time for football-loving Nigerians. But for as long as COVID-19 continues to ravage the world, the longer they'll continue to wait for the game they love so much. Deji Badmos, CGTN, Lagos, Nigeria.
Former Chelsea and Cote d'Ivoire striker